Hi everyone, in this video I want to talk about how a lack of understanding about complex health problems or the evolution in which healthcare or any normal life functions need to evolve developmentally according to the phase of life we are at. If that failure to understand that lack of development is present in people's lives, it can lead to wrongful measures, wrongful diagnosis, wrongful solutions for problems that are complex in nature, which people do not understand are complex in nature simply because of their lack of awareness or developmental understanding about such problems. So in many of my videos, what I've been trying to address about multiple aspects related to normal life practices or business practices or healthcare practices or the challenges that patients in India or globally patients are facing when they meet their doctors for a diagnosis or for a treatment regimen, all the places in which the treatment failures, systemic failures, misdiagnosis, prolonged diagnosis, or wrongful diagnosis is happening or occurring in the world, or places where false business practices are being conducted, or some general life related problems are arising in our regular life. All these problems escalate further and further when the wrongful solutions or misguided solutions or partial understanding of what is actually required as a solution is prevalent. At those times, you will see the problems that people thought could be solved by a X solution doesn't end up resolving that problem, and instead ends up escalating into creating certain other kinds of problems instead. So, in order that these complex problems get addressed a little bit more meaningfully in our future, that's one reason why I'm making these videos, and I'm trying to make them about different topics which might seem like a very ADHD thing for someone who is not well versed in these topics. But you need to understand that for me it is not a ADHD thing. The reason why I'm addressing different topics, sometimes from the personal life element, sometimes from my personal health element, sometimes from a practitioner's perspective, sometimes from a retailer's perspective or business operations perspective, all these different lenses I'm using to talk about some similar level problems is because all of these perspectives are actually technically involved in providing us a better quality life and better quality health on earth. But when people are working in these fields individually, when someone is working in business, if they don't realize that their business ethics, business practices, big business choices also has a overarching health impact on the population that will buy their products, or future health impact on the population that doesn't use their product and it gets discarded, and then some earth pollution parameters get involved in their product business choices. All of these, it's time for us to awaken to this overarching impact of our personal choices, be it a personal choice related to our personal life or a personal choice related to work life that we are doing on earth. Because every one of us's work life parameters, personal life choices, personal ethics, personal morals, personal way of doing things in life eventually ends up impacting overall multiple people associated with us. Some get directly impacted by our choices, those who live with us daily, those who work with us daily, they get impacted regularly. Those who travel with us regularly in the travel mechanisms we use to go to work or for some business and pleasure purposes when we are traveling, all of these impact our any person's personal health, physical health, as well as their family and friends and social circles or communities health as well. But likewise, those choices which directly impact someone associated with us directly in our life, there are also choices that we can make which can end up impacting someone else's life in the long term without us knowing how it impacted their life, because we are not following the train of things that we do, or we don't usually follow the whole net outcome of what choice we made on our earthly life. We are not following it. But is there a higher power who follows what is happening as a result of the choices we are making? Most of the time, there is a higher power which understands or follows us, or knows also what is the direction in which, if we go, what is the most likely outcome of the direction of the path we are choosing to take. And this awareness or information of the what is the most direct outcome or resultant outcome that will happen as a result of the path we are taking can sometimes get converted into a sixth sense ability called as claircognizance. So where you will meet sometimes people on this earth who know that if you take these choices, that the most likely outcome as a result of the choices you have taken is going to be X, which is also what someone who is like a scientist doing some scientific mathematical projection of something, when they do a mathematical projection of a data, even they can find out and predict that if, let's say, 100 people are using 100 bottles of water, how many bottles of water will accumulate in a particular area. Can you do a projection given the fact that no one changed the trajectory and people continuously kept doing one activity, where that will lead us, right? So how mathematics can predict where something will lead us if we keep on doing something again and again, like that can humans also predict that if you continue doing this same thing again and again, where it will lead us. And this information, why is it important for us to now analyze this information, is because this is how humanity actually shifts the trajectory of harmful things. Those who understand that if something is harmful for our future, and enough people have in the right places understand that if we do continue in this trajectory, a long-term harm is going to develop eventually, then those who have become aware that a long-term harm exists somewhere related to this, those are the people who eventually make the changes necessary so that the long-term harm doesn't occur, right? So for example, in the pharmaceutical industry, there are many drugs where people know that when drugs are initially tested in a smaller 1,000 scale population, the impact of a drug that you see in a 1,000 or 10,000 group of patients is not the same as when that same drug is going to be used at a million level. So because the impact of a drug at 1,000 patient level, 100 patient level is not going to be the same as the impact of the same drug at a million or billion patient usage level, we usually have after a drug has been studied for safety before it gets released in the market, after it has been released in the market, more safety data of such drugs are also done. And those post clinical release of drug trials that are done usually will test for birth defects, cancer causing elements, long term health harm associated with the drugs use. And in the past, when there were medications that showed that there was some harm associated with the drug after it was released in the market, and many patients possibly died or got some defects as a result of usage of such drugs, there were drugs in the past that have been recalled or withdrawn from the market, and the sales of those medications were stopped in the past when it turned out that that drug is very harmful for the patients and it will result in it's resulting in death of patient population, right? So like that, there were many drugs in the past and in the present also that are continuously being seen by regulatory authorities, where they determine whether this drug should be taken away from the market if a lot of harm is associated with a particular drug. But while these changes are being studied, changes are being reported, the fact that when is a true report of a drug being harmful able to reach the regulatory authorities? The time when a true harm of a product reaches the regulatory authorities and is able to then cause a recall or withdrawal of a product happens when everyone involved in the process of doing the work in the pharmaceutical industry, everyone who is studying patient health data, everyone who is mindfully observing what is happening to a patient's health status, they are all doing some ethical work. If I ethically report that my patient got harmed, if I administered them X drug and the patient complained that after taking the X drug they had certain side effects, and then I reported that ethically, then only the data related to that patient's health harm gets tracked into a database, right? But let's say the patient complained and the pharmacist forgot to report it, or the former pharmacist wanted to hide the data and didn't report it, or the patient is in a clinical trial and they reported it to the clinical trial administrator, but the clinical trial administrator didn't want to include it in the data for some reason. Either they were lazy, or they were unaware, or they forgot to enter the data, or they were too sick, and later on when they were meant to they decided that today I'm sick, I'm not going to enter the data today, but I will remember whatever the patient told me today, tomorrow I will enter it when I feel well. But when the next day came, they felt well, but they forgot all the data that the patient had narrated to them, and they forgot to enter the data. Or even if they remembered whatever the patient had said, while entering, sometimes when you are entering certain things, there is a normal human lapse in memory also that can happen. So they temporarily forgot to enter all the critical elements. That can happen. And then there are people who are unethical, who do not want to report that their drug is causing harm for some profit motivation or something, or they were told to hide the data by their bosses. At those times also, some people may not enter all the relevant data related to patient health status. So now, if unethical practices are there, if memory related problems are there, if the person while recording data didn't record everything, and let's say when patient was reporting also that they had some health symptom, but if let's say someone is a chronic acid reflux patient, they chronically have a acid reflux problem, and while they were entered a clinical trial, even though the data says they have acid reflux problem, and let's say actually the drug that they took as a part of a clinical trial was giving them acid reflux, but because they have past history of acid reflux, the patient could assume that the acid reflux they are getting is their past health history, and may not correlate that acid reflux with the new drug they are taking. So at that time, what will happen? The patient will assume that their acid reflux is from their past history. It's not associated with the new drug they are taking. So that's why they will not report it. So that way also, many a times people can make assumptions. They don't really know that whether their symptom is associated with a new drug that they are taking. So they will not report it because they don't realize it could be associated with the new thing that they are taking. At those times also, multiple data associated with a particular drug's usage pattern or side effect may not get reported, and when again only 100 patients are being tested for the drug, or 1000 patients are getting tested, lesser number of people might report it, and most of the time people also will not report it because they are getting most of them are getting free clinical trials. So when people are getting free clinical trials, or it's a free drug they are getting, there is also a bias created against that thing. Because it's free, people don't want to complain also about a free thing. That could also happen. And sometimes when it is not free, let's say some patients were paid to enter the clinical trial. Again, if they are poverty stricken patients, most of the time when you are poverty stricken, you are also going to be a little bit some of those patients who are poverty stricken are going to be very less voluble, or have lesser agency about speaking up about their problems. They're very subjugated and milder natured, gentler natured people sometimes. So when you are a milder natured person, gentler natured person, that time also you may not speak up about some trouble that arose in your life, simply because you do not have the nature to complain. Those people could also be entered in a trial. There could also be those people who, even if they know that this is the problem, they have this inherent personality trait of not expressing their problems very easily. So unless someone asks you, did you feel stomach ache, headache, this, that, some people will respond to you. If you ask a patient, did you get a headache, do you have a stomach ache, did you have a hand pain, leg pain, sleeping problem, this, that, if there are 10 set of questions you ask a patient, they might give yes or no answer to you. But there are certain people who will not provide voluntarily any information if they got a headache, if they got a backache, if they got a eye vision issue, if they got a muscle cramp, whatever they got, because many a times people tend to ignore also their symptoms. So unless asked about those symptoms, many times those symptoms also don't emerge. So that's why during the initial clinical trial phases, many of these things don't get reported. But why do they eventually get reported as a problem associated with a drug a person is using when thousands of people are using the drug? Now, if thousands of people are using the drug and that drug being a new drug is an expensive drug to buy, at that time what will happen if I pay, if I get a chocolate from like simple human habit, if I get a chocolate free from my uncle and I buy a 100 rupees chocolate, the uncle also gave me the same chocolate. Say they're both the same brand chocolate and the same chocolate that I got. One was free, one was from the store I bought. But last week I got the free chocolate. If I ate that free chocolate and I got stomach ache or acid reflux or headache or something after consuming the chocolate, because it was free chocolate, I might ignore the symptom, or even if I felt the symptom and I associated that symptom with eating that chocolate, I will not say anything. Or if I complain to my uncle will think this person is ungrateful to me. I gave her a free chocolate and she's complaining about the chocolate. So most of the time, most 90 to 99% of the people who got that gift from that uncle will never complain about that free chocolate gift, even if they had some health problem with it. Very few people, and that too the 1% who will complain, got possibly violently sick. Like let's say I ate the chocolate and I fell asleep, I got dizzy and drowsy and I fainted or something, I might complain because of that, because it was a very stark response. But if I had a milder response like a minor headache, I would not say anything, right? Because that is human tendency. But that same chocolate, now I went to the store and bought this week, like let's say I ate that chocolate, I had a minor headache, and but I love the taste of the chocolate and I now want to buy that chocolate. So next week or next month I went and bought that chocolate from the store, and while buying I saw that it was a 200 rupees chocolate. So I bought that 200 rupees chocolate, and now it's the same brand. Let's say it's also the same batch. Everything was the same. Same brand, same flavor, same batch, same facility from which it was manufactured. Now, firstly, in the first week when I ate the chocolate and I ate the whole chocolate, I ate let's say 15-20 pieces of chocolate. Each of those chocolate pieces, because only 20 pieces were eaten by me, I got some response from eating 20 piece chocolate. But the next week, now that I ate another 20 piece chocolate, now more of the chocolate has built up in my body. So now my overall response in the body is not simply coming from the 20 pieces of the new chocolate that I bought, but some of the response will also be coming from, if the chocolate didn't get eliminated from my body, a little bit of its ingredients are still somewhere in my stomach or somewhere in my bloodstream, the overall impact on my health will be related to the first 20 chocolates remnants that were still there in my body, as well as the next 20 chocolates pieces that I ate that day. So at that time, when my second bar of chocolates response will have first bar related minor response and major response from the second bar's impact. And at that time, if there was something toxic in that chocolate that is health harming for my specific health, if enough has accumulated in my body after eating that second bar of chocolate, if in the first time I ate the chocolate I got a minor 5-minute headache, it's possible in the next week after eating this second bar of chocolate I got not a minor headache, but I got a little bit longer headache, like half a day of headache could manifest. If I'm eating that chocolate regularly for a month, every week I'm eating 20 pieces of small chocolate bars, and every week I have consumed like that chocolate, and that chocolate was harmful to my health. Slowly, if enough of the toxins are building up from that chocolate in my bloodstream and in my body, that minor headache which I got from the first chocolate bite could have very well escalated into a full-blown migraine headache. So at that time, and every week, if I'm spending 200 rupees buying that chocolate, and after let's say 4 weeks or 6 weeks of consuming this chocolate, I am 100% sure my headache is coming from this chocolate, because every week I'm consuming this chocolate, I'm getting that headache. And if I stop taking the chocolate, I can also see that the headache goes away if I don't eat that chocolate. Then is the chocolate the root cause problem? Most likely or not? Most likely, for again 99% of the cases, the chocolate will be the root cause of the headache. And then at that time, because I have been investing now 200 rupees every week buying that chocolate, will I not complain to the manufacturer, or will I not complain? Again, most likely outcome is, if I have correlated something to this product, I will likely complain to the manufacturer. Now again, instead of me, if there is another girl who also ate like this, like me, for 5 weeks chocolates, also ate the same chocolate, who also got headache also from the chocolate, but she is too busy, she doesn't have the time to complain, will she complain? No. Again, the person who will complain about the product, who will complain? Someone who has the time to complain, someone who has got the time to report, someone who knows where you should report about this product, someone whose reporting will be taken seriously. Because if I am a 5-year-old girl making this complaint, if I complain to my parent about it, like my parents are buying the chocolate for me, and while when an uncle gifted me the chocolate, I didn't complain, but when my parent is giving me that chocolate every week, I am complaining. If my parent is a jealous parent and realizes that if your uncle didn't complain, why are you complaining for me? You shouldn't complain in front of me, you didn't complain in front of your uncle, then will that 5-year-old child's headache be reported? No. Or if their parent is very busy, they are not observing that the child is getting a headache, will that complaint get registered? No. If the child is a younger child who never complains but is still getting a headache, again, if she never speaks up about it, will it get reported anywhere? No. If it is also someone who doesn't correlate that they are eating, they're getting the headache actually because of the chocolate, but irrespective of age, whether they are 5-year-old, 20-year-old, 30-year-old, 50-year-old, if they never correlate, they are very unmindful people, or don't observe, they eat too many things, so they don't observe what is causing their health problems, again, the reporting will not happen. So when will the reporting happen? Reporting will happen when someone has the free time, when someone has correlated a symptom to a particular product, when someone has crossed the enough threshold of pain to complain about it. Because a product has to also give you enough level of pain, enough level of suffering for you to also go and formally register a complaint about that product. Which is also similarly true, like with a chocolate, it's also similarly true with a drug. Like if I am paying $0 for a drug and it gave me a headache, or I vomited severely, or I had severe stomach cramps, and it only cost me $0 because maybe I'm in a government plan where the government pays for all my medications. Again, 90 to 99% of those people who get free healthcare access will never complain about the medication that they are getting, simply because they are not paying anything for it. It is coming from their work. So because direct payment is not involved, and it is essentially kind of like a free item for them, all they might do is they will stop using that product. But if there is another person who is not in a government program, who is in a private insurance, and that person ends up paying $100 for a medicine versus their previous medication was $0 or only $10, and now they are seeing that with a $10 medication they didn't have so many side effects, but with a $100 medication, even though the doctor said this is a new medication, it will work for you, but even though it's considered to have, they've done a lot of studies to show that the newer medication is better than the old medicine, many of those studies are designed in such a way that it will be better for certain class of population, definitely. but for certain class of population it may not be better as well. So now if you fall into that patient group for whom this new medication is not better than your prior medicine, or not taking any medicine at all, at that time will you complain or will you not complain? You will complain, especially when you are paying high amount of money for it, when it is supposed to give you benefit, but instead of giving you benefit it is causing you harm. When not only some minor level or moderate level harm is happening, but let's say the patient dies, at that time also someone associated with the patient might complain. But again, who will complain when the patient dies? If the patient dies, if their family cares about them, were grief stricken about their death, and again their family had correlated their death with the use of a new drug, that is when again the correlation related to health harm related to a drug will get reported, get investigated, will get a news media coverage if someone or many people died, right, in order for that drug to be withdrawn from the market. But if at every bit of these levels, if they have a family who don't care about it, and in fact they are happy that their parent has died, will they register a complaint? No. If someone's family has died and they complained about it, but the pharmacist didn't register their complaint for some reason or the other, or the doctor didn't register their complaint for some reason or other, again, even if a complaint was said verbally, it didn't get recorded in the drugs database. That could also be a problem. Then the third problem could be when a drug interaction has happened, where maybe this drug plus another drug the patient was taking, both in combination are causing some effect. Now that drug interaction effect also will be reported when a wise doctor, wise practitioner, understanding practitioner, a practitioner who asks the deeper level questions is registering the complaint and inputting the data regarding that complaint, then only the right data for a drug interaction will also emerge, right? So do you see how many steps are needed, how much mindful work of how many people are needed, how much real care and caretaking is needed, how much also people authentically speaking about what they are experiencing is needed in order for a real correlation of a health harm to emerge about a drug. And that's why there will be many drugs sometimes in the market which stay in the market for 10-20 years without people complaining about its use, but after 10 years also sometimes new data related to certain things, health harm, can emerge when enough people are getting a lot of health problem with it, enough people's problems were actually registered by a company, enough people in the company are ethically involved to give credence to the complaints that were coming about that drug, enough people are ethical enough to withdraw the market, the product from the market. If that doesn't happen, sometimes even if hundreds and thousands of people have complained about a product in the market that is health harming, if the right interventions doesn't happen from the company level at that time, and some illegal gray zones they use to hide the data, at that time there could be many products in the market that are health harming which is not getting checked or withdrawn or regulated by the market conditions, and they are continuously getting used by people without people being aware that a health harm is unfolding in their midst. And this is why I am talking about this problem, because there is a lot of health harms unfolding in globally in our daily lives that people are simply unaware about. People don't know where the health harm is occurring. Even if those right people know where health harm is occurring, they are not ready to take the steps to prevent that health harm. There are governments who are doing this because of biological warfare related things and other political motivations as well. So there are multi-level problems right now escalating globally, which if not resolved in the right way will lead to multiple people dying in certain areas, will lead to, if human action doesn't cause the death of those people, Earth's own actions ends up causing death in those areas. For example, if you have seen recent reports of volcanoes erupting in Hawaii, few years back volcanoes didn't erupt in Hawaii, but few years back there were tsunamis and floods and other damages, hurricane related damages that occurred in Hawaii. So all these inclemental weather conditions that are impacting Hawaiian life. And why is it impacting a island nation? Because island state is because islands are smaller pockets of the world where land area is less and water area and air area is higher in those islands. So as a result, the natural calamities are much more easily observable in a Hawaii like place. So that's why. But why is it also important is because when most humans, we live on land. So when we live on land and when human led pollution parameters are high in our land, and at that time where in those places where land area is less and air and water is more, then air and water related weather conditions will arise related to tsunami or even land related ones related to earthquakes. This will arise in those areas more prominently because there is a lot of, because smaller area of land is there, the earth pollution is not sustainable in that area. And because the earth pollution is not sustainable in that area, all natural elements will gather together to end and stop that earth pollution from expanding further. And that's why if lots of wrongful practices led by humans are going on in those areas, those are the areas where first natural calamities strike. This is equally true of Hawaii as it is true of Japan as well, where again earthquakes and tsunamis have consistently been occurring in their land. So any place, and island nations are, or island states are the first places where these tsunamis, earthquakes impact gets recorded very easily. But that doesn't mean that in our land also of there are other parts of US also where tsunamis and earthquakes are occurring currently, or wildfires are occurring currently. There are other places of India where we have hurricanes and floods and natural disasters like earthquakes also happening in countries like India. So why are they happening? Because those are the places where there are not enough humans understanding how human-led activities are destroying the planet, destroying their local ecosystem, causing a long-term health harm that humans are not able to keep it in check. And when humans are not able to keep it in check, then natural disasters arise for nature to keep it in check so that it doesn't get those misused or misunderstood practices doesn't get spread out to other humans as well. So now those people who are from those drought areas, hurricane areas, tsunami areas, flood areas, earthquake areas, if they really do not want a repeat of the natural calamity that destroyed a majority of their life, they all have to wake up to what do they need to do differently in order for the repeat of the past to not unfold in the future. But if you do not have a complete picture of what is it in our past that we did that is continuously being replicated and causing a health harm in our present and will also continue to create health harm in the future if not checked, if we don't have the right picture only, if we don't get the right picture of what was actually going on that led to the natural disaster to unfold, then you don't learn the lesson that you were meant to learn as a result of being a survivor of a natural disaster. And this is where currently globally humans are standing, because not only because of all these natural calamities that we have seen a lot of deaths in the recent years or decades of our life on earth, but other than the natural disasters, the number of diseases that humans are suffering from has also escalated in recent years. And natural disaster and disease and wars, all of these three things are the triple threat that emerges in our human life when humans are failing to understand what needs to be kept in check, what is it that needs to shift and change, when humans are also oppressing the feminine energy and devaluing the need for criticism where criticism is needed. Because in order to actually check any of the natural disasters from unfolding, in order to actually check from multiple people dying from coronavirus, the proactive things that people do to like vaccination programs that people are doing, or the proactive things of natural disaster management that people are doing, that proactive thing works when the disaster is actually unfolding. But There is something the negative energy does, which allows, if you give negative energy the right space to function, the balanced space to function, negative energy is supposed to shift you towards taking a better alternative where coronavirus doesn't exist anymore in the world, or not that many coronaviruses will exist, or a world where not that many natural disasters will exist. But in order for feminine energy to work in a balanced manner, what is needed? People have to be open to listening to when someone is challenging that if you do this step, it will take you towards a natural disaster. But if you think, oh, if you think positively, this is not going to happen. That is a false positivity people engage in life, which multiple people in the world are globally currently engaging in a false positivity measure, where they don't understand that when someone who has the right negative energy is telling, and a balanced negative positive energies outlook about a situation is telling you that if you do XYZ measure, it will lead to a disaster. It's not that they're calling the disaster in your life. They are just giving you a mathematical or logical projection of what is going to unfold if you continue doing activities that is going to lead to a health harm, because that is the only trajectory left. And when someone is telling you that this is the only trajectory left, that you're going towards this health harm, first you have to understand why they are telling you that. When you understand why they are telling you that, and then when you understand that from what understanding level they are telling you that this is going to take you to health harm, whereas if you don't do this, you shift your perspective into doing, instead of going the ABC path, let's say you have to take a DEF path instead, and then if you take a DEF path, then you will not go to the health harm. Then only you can shift into going towards shifting the trajectory of the health harm that you're going towards. For example, very simple about Japan, I'll talk about this, because in Japanese culture, that's a very technologically oriented culture. There's a lot of technological advancements that has happened in Japan, which has not yet been translated or given to the rest of the world. But because of the technological advancements, operational advancements, efficiency related advancements in Japan, a lot of electricity was continuously being used because of these advancements. As a result, because a lot of electricity is being used, Japan has many nuclear power reactors in comparison to a same sized state of some other country. And when there are a lot of nuclear power reactors, even though Japanese nuclear power reactors have been made and built in the sea-like areas, I think, because that is what I perceived about Japan, that the nuclear power reactors are more near the coastal areas, or more likely to be in the sea, under the sea. Why am I presuming that? Because my dad also worked in nuclear power reactors, and I know that the nuclear power reactors, many of the nuclear power reactors in India are also developed in those locations near the sea or near some water body. There are very few reactors which are developed near the land area, which is another stupidity that many countries have done. If you have put a nuclear power reactor in a land area, you're already setting up that area for a long-term failure in the future. But let's forget about the land area related nuclear power reactor positioning. But the nuclear power reactor which are near the water bodies are placed in the water bodies in order for the reactor to not go into a critical status, in order for the water in that area to cool down the reactor. But when the reactors, whatever normal functionality is going on in that country to manage the reactor, to keep them from becoming critical, if mismanagement is going on, or misunderstanding is going on about how a reactor becomes critical over time, not when initially you started operating, the reactor after 50 years of operations will have a very much different set of conditions now playing in its environmental conditions that will impact its overall functionality, which is what has happened in Japan, which is why the heat is now not being checked by the sea level of that area at all, which is why earthquakes and tsunamis then have resulted in Japan, because that is the only thing left for Earth to do, to shut down the business activities, to shut down the local activities, which is not sustainable by Mother Earth in that area anymore. And this is the same reason why earthquakes are happening, volcanoes are happening, tsunamis are happening, multiple, not just because of nuclear power reactors activities, but any other human-led earth pollution activities. Nuclear power reactors are the most starkest and most easiest things to observe, because you can observe radioactivity levels very easily. You can also actually diagnose patients with radioactive poisoning also much more easily than other chemical poisoning related health harm. But in those areas where radioactivity is not happening, or not that many nuclear power reactors are there in comparison to, let's say, Japan, because Japan is like, let's say, the top contender of a lot of nuclear power reactor related usages. But if Japan had the highest number of nuclear power reactor, let's say another country has only 1/10 the number of reactors as Japan in comparison to the population density. Even then, even if you have much less reactors, but let's say you have one nuclear power reactor in your country, but you have high chemical usages that are also health harming. Will that nuclear power reactor plus the chemical usages in your regular locality also add to long-term health harm, also invite natural disasters? Yes, that is also going to invite natural disaster, diseases, long-term health harm. Plus, there's another country where they do not have any nuclear power reactor at all, possibly, and they have only chemical poisoning going on in that area. But let's say now some other country has introduced biological warfare in that area and have introduced biological toxins in that area. Again, will the chemical toxin plus microbial toxin of that area also eventually result in long-term disaster to unfold in that area, leading to mass kill deaths in that area? Again, very possible likelihood can happen. And could there be another country where nuclear reactor related problems plus chemical pollution related problems plus microbial contamination related problems, all in combination, can cause a triple threat of health harm unfolding in that area? The answer is yes, and this answer is yes, and it is unfolding globally, where in certain countries inadvertently, because people are unaware, unmindful, unconscious, not aware what their daily work choices, life choices, ethical choices, moral choices, how they are impacting their own health directly and indirectly. That also, that many people in the world are like that. And then there are many people in the world who are consciously making these choices to add to health harm of people, who are consciously engaging in biological warfare, other kinds of nuclear power warfare. I don't know what shit is going on, but meaning I don't exactly know the level of warfare related crime that is going on in the world, but subconsciously I know it is going on because of the mere fact that I am in the midst of some of these health harms, where I can tell that some of these health harms that have been introduced in the Indian market are deliberate health harm. Some of the health harm that have been introduced in the market are people's stupidity led health harm. Some of the health harm introduced in the market are ethical problems related health harm, and some of the health harm are also related to people not even realizing the simplest activity that they do, how it adds to health harm of multiple people, simply because they do not even understand their own work at a deeper level, which is a problem zone right now, because many people do not understand their work at a deeper level. Many people do not do their work at a meaningful level. Many people are closely are like doing work as if there is no disaster unfolding in the world, and they want a very easygoing life, quick fixing kind of a work life. So they are constantly seeking a quick fix in their work life problems, and as a result, the quick fixes that they are putting into their work life adds to more and more problems, and real resolution of problems are not happening in the world currently. And this is a place where people have to start awakening to where they are contributing to world health problems. And even like a simplest, a chaprasi of a company could be contributing to a company's health problems when they invite, and for 1,000 rupees BD given to them by a friend, they will invite their friends and give their friends a whole tour of a facility where that friend has actually come to do some biological warfare. Have you watched that show, The Americans? In Americans, if you I think it's called The Americans, I've forgotten. I think it's The Americans, where actually covert spying related storyline was there, but that covert spying related storyline which was shown about America is equally true about any other country of the world as well. And in our country, the problem is the doctors are operating, at least the doctors I have met are operating at a level where they are assuming, and not just in our country, in US also have met these doctors. It's just that my majority complex health problems escalated in India, and that's why people might presume that this is just a India problem, but it is actually a global problem, that any patient who has complex health issues currently is invariably 90% of those patients are getting misdiagnosed, mistreated, partially treated, or untreated until a full-blown disease happens to them, which is now also adding to the burden of earth pollution, because the later a patient is treated, the more a patient is misdiagnosed, false strategies will be used to treat them, wrong strategies will be there in treating them, partially harmful strategies might be there in treating them if someone has complex health harm going on, all of which then eventually adds to the burden of health on the patient as well. You might be spending lots of money and time and medicine on treating a patient, or even using a lot of hospital and clinical resources to diagnose and treat a patient, but all of which will be futile when the patient, the doctor doesn't have the right idea about what is going on with the patient, which is what I have been facing for a while in the last few years, where slowly, step by step only, the universe actually guided me, because even though I am a clinical practitioner, I was also not that high level clinical practitioner in the past. I was operationally a very good practitioner, but clinically I was not that clinically savvy. But slowly, as a result of my clinical health problems only, and every time I was facing a challenge, I could understand where the clinical parameters were getting misdiagnosed, or wrong clinical testing was being done, or and I'll talk about my how clinical diagnosis gets messed up in India in my next video. But because multiple problems were going on with me, sometimes the doctor is assuming, let's say I have 3 problems going on with my health, which did happen for me at one point of time. I was getting heightened allergies, I was having possibly some chemical contamination related health conditions impacting my health. I was also possibly in the beginning stages of cancer at that time. So all of these 3 conditions were happening simultaneously in my body. And with the cancer related symptoms, some of the symptoms were pesticide poisoning, that if not treated, if I have pesticides in my body that are causing poisoning in my body, they can lead to cancer or organ damage. Now, if the doctor realizes I have pesticides in my body, I am getting pesticide poisoning, does the right test to ensure that pesticide is detected in my blood, to then give me the antidote to the pesticide and give me the right protocols for de-escalating that problem, then I will go towards recovery. But if the doctor doesn't do that, if they do not understand I have pesticides in my body that is leading to pesticide poisoning, if they do not understand and do not want to even take the steps, like, while as a patient I could have more information than them, because I am in a toxicology field, I have studied toxicology, because I have studied toxicology, and some of these measures related to pesticide poisoning were directly impacting my health. So I was 90% sure that pesticides were part of my problem. But even though I am convinced that pesticides are part of my health problem and condition, because every time I'm inhaling a pesticide being sprayed on my clothes or on the outside locality, I'm getting a breathing distress. There was a direct correlation. But if a doctor doesn't trust the patient's narrative, that is a major problem zone now with the doctor, because you are going to now not treat the patient rightly. And out of what reason you are doing it, I can't say. Some doctors could be unaware, some could be unconscious, some could be uneducated, and some are also deliberately very egotistical, not understanding that the patient could be giving you the right guidance. You as a doctor are meant to get majority of the patient's health information from the patient, not from whatever textbooks you have read. Textbooks are only supposed to be the guiding map, but the patient's actual health status is supposed to be the real map for what is going on with the patient. And at that time, if you ignore patient data, that patient is verbally saying that this is my problem, and all you had to do was do one test to ensure that the patient do they have pesticides in their blood or not have pesticides in their blood. Only one test was needed, but instead of doing that test, they were not ready to agree to give me that test. So then what was my solution then? They were not giving me the test that I was needing, and at that time I was 90% convinced that pesticide was indeed causing my health issue. What did I do? I moved away from this area where heavy pesticides were being sprayed during the summer and rainy season, and for 2-3 months of the rainy season I stayed out of Mumbai. And the moment I lived outside of Mumbai and places where pest control was not as high level as here, immediately some of my symptoms dissipated. Like in my pulse oxygen meter, my heart rate were really high, my SpO2 levels was really low, and no, SpO2 levels were normal. My heart rate was really high, but my perfusion index was really low. But the moment I moved to an area where less pesticides were used in, and I shifted and lived in a different state of India, and in that state I lived in 2-3 different hotels or homestays. Whichever homestay didn't use pesticides, whichever places didn't use pesticides, my health was much better. My perfusion index was much more improved. My heart rate was much more stable. And the moment in those places also, some of those homestays would suddenly do pest control. When they would suddenly do pest control, if for 2 weeks I stayed there and there was no pest control done, my health was relatively better. But the moment they were doing pest control, again my heart rate would increase, again my anxiety levels would increase, because anxiety, heart rate, excess breathing distress, these are all also symptoms. Agitation in your personality, all of these are symptoms of pesticide poisoning. And actually in those facilities also, those people who now do regular pest control, like let's say they are doing pest control once a month, and if their water supply is equally impacted like how my house's water supply or air supply was getting impacted, if your water and air pollution levels are higher and some pesticide remnants are still present in your area, because people don't realize this, but once you spray a pesticide, it doesn't simply disappear from earth. It goes into your water, it goes into your soil, it will go into your trees and plants also that you're growing in that area. And from that water, when you're washing your clothes, cooking your food, it will go in, or taking a shower in that water, it's again going to get absorbed by you. So it continuously a feedback loop of pesticide contamination will be happening, which is how pesticide poisoning is developing in those people who use even pesticides randomly once in a few months or once a year. Pest control has been done, but if you have done enough of that pest control regularly, enough accumulation of that pesticide can be there in your water systems to lead to pesticide poisoning related symptoms in your body. And this thing, though I tried to educate that doctor about it, that doctor was not ready to understand this concept. But while the doctor was not ready to understand this concept, could I just sit and continuously keep inhaling pesticides in an area where I have no control about the pest control being done by someone, or if someone deliberately sprays pest control pesticides on my clothes or bed sheets? Can I do anything about someone else's choice? I can't do anything about someone else's choice. But what can I do? I can remove, because the first step towards any kind of poisoning happening to us is you have to remove the contact toxin exposure. So if at that time the only contact toxin exposure is for me to I complained to the municipality about it, and municipality, I'm thankful to the municipality here that they over the years decided to reduce the usage of pesticide in this area. So the municipality complaint worked. But municipality complaint worked because they saw the value about pesticide poisoning related harm happening to the population. But if a municipality complaint happens and the municipality doesn't realize that pesticide is involved in health harm escalating in that area, would that municipality will do the right work? No. And in that area, or if you have a family member which I literally faced with my family, I tried to convince my family in my home and in my cousins' homes when I went to stay with my cousins to see whether better health conditions are there in their state. Again, if I told them that these chemicals are causing health harm in my body right now and I cannot get exposed to this, but if they are not ready to listen, my first pesticide poisoning actually started from the spraying that was done in my cousins' homes. From there, my major pesticide poisoning related symptoms first started, and from their homes then the next pesticide poisoning exposure happened inside my home, where my dad, being a little bit mentally ill, was deliberately spraying pesticides on my bed sheets, on my clothes, simply just because he has some antisocial personality behavioral patterns. Then the third pesticide poisoning exposure was happening from the municipality choices or society choices in the two places that I used to live in. So all of these they were happening in a span of 1 year time, and in that 1 year's time, from multiple sources of pesticide exposure. One from my building, my second one was from my cousin's home, which was the second direct exposure inside the home, and first direct exposure inside the home. The first exposure had happened from society related spraying in my building premises. So firstly I got pesticide exposure from building premise pesticide spraying. Then I got direct at home spraying because my upstairs neighbors was doing some activities where they were changing the tiles of the building, and when they were changing the tiles of their flooring, at that time also pest control is done in India. So when they are changing their tiles, they are spraying pesticides there. That pesticide spray also caused excess pesticide poisoning to me, because while they're spraying on their tiles, our homes in India are not non-porous homes, and there are holes also present, are fan ventilators, lighting ventilators. From the lighting and fan ventilation areas, the whatever spraying was going on in the upward upstairs flooring, those spraying was also getting permeated into my home. So from there also I got pesticide exposure. So within a span of 1 year, I had pesticide. There are 5-6 different sources of pesticide exposures I had accumulated by the time I went to the doctor with this complaint. But so I was not illogical when I said that pesticide poisoning was likely happening to me. All the symptoms were there. All the 5-6 times I was getting exposure to pesticides from 5-6 different sources were also there. Despite that, it's very difficult to convince a doctor in India about this pesticide poisoning problem, which is a major health challenge, not just in India. This pesticide poisoning related problem had happened to me even in US. But at that time, because while in India in 1 year span I got 5-6 different kinds of exposure from pesticides, in US I had in a span of 3-4 years got exposed to different kinds of pesticides, which had escalated into my health harm. But at that time also, the doctor there only could diagnose it as a lung problem. They couldn't diagnose it completely as I didn't get a pesticide poisoning diagnosis at that time as well. And at that time I was also a little bit less clinically aware, though that's why I also didn't correlate my health symptoms with pesticide exposures. Only after facing that repeating problem in India, and even though it was a different country, different pesticides were used, some symptoms are very similar to different to our health when we get exposed to pesticides, because chemicals are common in multiple countries. So similar chemicals or same chemicals are used for pest control in all countries of the globe. So if people assume that pesticide poisoning related problems only happen to you when you live in India, it's a false paradigm. It can happen in Korea, it can happen in America, it can happen in Japan, and not just pesticide poisoning problem. At that time it was pesticide poisoning plus other health conditions that were combined impacting my health. I didn't realize it back then, but now I have slowly started awakening to the fact that it was not simply pesticide poisoning that was happening to me. It was not simply just what the doctor suggested. The doctor was thinking it could be mercury poisoning, and it is possible that I could have had mercury poisoning also developing at that time. But while I'm giving a blood sample for a test, how many times should I give blood samples to a doctor? Shouldn't, if the doctor suspects it's mercury poisoning, I suspect it's pesticide poisoning, couldn't she have given a prescription where both pesticide and mercury together could have been tested for the patient? She could have done that, but she was not ready to do that. So that, which is a very much of a problem zone now, because let's say I did have mercury poisoning and pesticide poisoning and some other chemicals in my food related health issues going on, or at that time later on, or 6 months before I met her, at one point of time I had also fungal infection related poisoning going on. All of these now, whether that fungus was still present in my body, I don't know, because at that time also, even though I had concrete evidence that fungus was the root cause of my problem, all symptoms related to fungal poisoning was manifesting in my health. While I had the concrete evidence, when I gave my sputum sample for analysis, if the person doing the analysis didn't use all the sample that I have given, they only use the upper respiratory tract sample rather than the lower respiratory tract sample, then they would not have found fungus at all, because in my upper respiratory tract at that time I was not having fungal related problems. My main problem was from this chest area. I was having heavy cough, the kind of cough where tightness in the chest was there. But while tightness in the chest was also there, when I was coughing, along with that cough that was coming deeply from my lungs, that cough was also emitting blood, and which scared me. And at that time it was again, at that time when I was coughing like that, blood plus sputum and heavy coughing was involved. The coughing related symptoms were all associated with fungal poisoning, whereas the blood that was emitting was related to some kind of chemical poisoning that had happened with me. Now, if you do not analyze that sample which has blood, if you do not take the fact seriously that when you're coughing up blood, something important has gone wrong in your blood. Otherwise, why will you cough up blood from your chest, right? That doctor had no ethical or concern at all that a patient is coughing up blood. Not just that doctor. I spoke about that symptom to a couple of doctors. Not a single doctor I met who is concerned of the fact that if a patient is coughing up blood, it is a important health anomaly, and it is an important health criteria symptom that should be examined about a patient, because you should not be emitting blood just like that. Only if you have TB, if you have chemical damage, if you have some other poisoning related damage going on with your health, that is the time when, and it was not the same bleeding as when you have, the doctor can assume you are just having a nasal bleeding from some other issue, a simple allergy or something, but I would not be scared about it. This is another thing. You have to distinguish between the patient population. When a patient is saying I'm coughing it up from the chest, and the blood that comes up from your lung area is very different from a nasal drip bleeding. When you bleed from the nose, the bleeding that will happen, when occasionally I have bled from the nose also in the past when I moved to US. At that time when you bleed from the nose bleeding is a steady flow of blood. Whereas if cells are getting ruptured and causing some bleeding, it is a compact cellular structure plus blood. So it was a very different kind of a blood. This distinction also normal doctors don't seem to have in India. So which is a problem zone, because this is how anyone who watches my video or wants to do biological warfare in India, or this section of the part of India where they want to do biological or biochemical warfare, they can very easily do it, because they can test like this, like how I went through all these health challenges, and none of them are getting diagnosed or treated, or doctor is ignoring all the symptoms, even though all symptoms are present related to that health issue. If like that multiple doctors in this area are like this level incompetent, you think someone who wants to do biological or biochemical warfare can't easily understand that the doctors in this area are stupid, and it's very easy to introduce multiple things in the market here and lead to mass scale death in this area? Is it easy or not easy? If I continuously don't get diagnosed for any of these illnesses, if it is a pesticide that is still like while stopping the pesticide spray from in the local environment prevents me from having the health harm escalation right now, right? But if still some pesticides are not eliminated from my body because of different reasons, and some amount of pesticides from past 5 years exposure is still prevalent inside my body, at that time, do I need pesticide poisoning related treatment, or do I need a doctor who will not give me treatment and I have to suffer for 5-10 another years? I've already suffered for 5 years as a result of these things. For 5 years, I have suffered through pesticide poisoning. For 4 years, I have suffered through fungal related symptoms. For a few more 5 to 4 years, I have been suffering from pre-cancer or cancer-like conditions as well. Organ damage has also started manifesting in my body because I became so weak and so immobile. I can't move around like a normal person. Whereas in the past, I was a very active person who used to actively work 10 hours. It's not a joke, standing in a pharmacy for 12 hours, talking and walking around in the pharmacy and dispensing hundreds of medications daily. That is the level of work I used to do. I used to work out in the gym for 1 to 2 hours daily. I used to go out for 1 to 2 hour walks in India daily. And I had gone from that health status to a health status where 5-minute walking was not possible for me. And this thing also, no doctor seems to take that seriously, that a patient, when the patient is saying I was that high level active and now my activity level has gone down drastically, for a doctor it is like I don't know what is wrong with those doctors, but they seriously lack empathy. They seriously lack understanding that it is a critical health concern if a person who is easily able to walk for 10 hours, 12 hours, easily able to walk in a pharmacy, like from one end of the pharmacy to the other. It needs some moderate level human activity to be able to continuously walk in a pharmacy, continuously talk for 10-12 hours with patients in a pharmacy, or doctors and patients and other people in a pharmacy continuously. So that level I could talk. And now if you watch some of my past videos, you will see after 1 hour or after half an hour, sometimes I'm not able to talk at all. That is a severe drastic difference from someone who can talk for 10 hours in a day to not even be able to talk for even half an hour. Right? Same way, if you can walk for 10 hours in a day, I was moderate level only walking in a pharmacy. I'm not like doing a trek or hike or anything, but at least I was walking, right? I had walking capacity, and that walking capacity was only going away from me, which is a major concern, because it could indicate chemical poisoning, it could indicate cancer, it could indicate organ damage, it could indicate someone is in a critical health status that within a few hours or a few days or a few years they might die because multiple organ failure is originating in their body. All of these things the doctors don't seem to be concerned. And then is there any reason why millions of people, billions of people are getting hospitalized and then dying due to coronavirus and other things? Because, and I will say and other things, because even though those patients who died from coronavirus were diagnosed as dying from coronavirus, I am 90% sure majority of those patients didn't just have coronavirus infection in their body. They had coronavirus plus other health impacting conditions of their life. Those health impacting conditions that get ignored by doctors. When you go to a doctor, and why is a doctor not able to critically analyze all these things? Either because they are untrained, and the second thing is, many of our doctors in modern life have gotten used to only checking a patient's health status based on the clinical testing that has been done on them. So if I had done the mercury poisoning related test and it showed mercury, and they told me do some other heavy metal poisoning related tests. So fine, if I had gone through that mercury and heavy metal poisoning related test, and let's say my body shows I have mercury or other heavy metal poisoning going on with my blood or body, but if say I have mercury poisoning, arsenic poisoning, because arsenic was also one of the ingredients that was causing poisoning in my blood. So I agreed with her that you are possibly right. It could be these things, that one of these heavy metals or a few of these heavy metals leading to my poisoning in my blood. But when I have given you an extra information, why aren't you also ready to investigate that extra information? What is the ego in investigating the extra information provided to you? When I'm saying like there is a direct correlation with me having a breathing issue as soon as pesticides were getting in contact with my body or inhaled by me. So that thing is a problem, because if I have pesticide poisoning as well as mercury and arsenic poisoning going on, as well as fungal infection going on, but only thing you investigated is the mercury and arsenic poisoning, you may give me a medication for treating mercury and arsenic poisoning, but will my whole overall health status improve after getting treatment for those two conditions? No, I will not get the complete recovery, because I still have pesticide in my blood, I still have fungus in my lungs, which you didn't treat because your system and the person who is analyzing my samples is not doing the right analysis. There are also so many chemical poisons currently introduced in our Indian market, and though actual data, newspapers have done all these newspapers, research labs, they have done all these testings which has shown that our nutritional supplements, our health drinks, our many spices used in the Indian market, they all have multiple chemical poisons in them, either pesticides or arsenic or heavy metals or any other random chemicals are also there in our products that can be long-term health harming for us. But while newspapers have done their due diligence, chemical testing labs have done their due diligence, the doctors are not waking up to do the due diligence, that how does that correlate to their patient's health. Like if you have found in the newspaper article, if 2 years back, 10 years back, 4 years back, that Indian spices are have heavy metals in it, have other chemical poisons in it, should you, if you have read only heavy metals, and should you only be testing the patient for heavy metals consumption, or should you also be testing the patient for heavy metals plus other chemicals as well? And when will those other chemical related poisoning be detected by anyone if the doctors are not waking up to the fact of a simple thing like a pesticide poisoning of a patient who has 30 symptoms of pesticide poisoning manifest in their body? Like if then imagine I had almost all there are total like about I had made a list of about 40 symptoms that can manifest in a patient when they have pesticide poisoning, and in that list of 40 I had about 30 of those symptoms that had not manifested in the last 1 week of the pesticide exposure, but over the time of the 1 year of different pesticide exposures that were harming my health. So I had 30 symptoms that had manifested in my blood and in my body and in my health. And that too, me being a conscious medical practitioner, and I had to sit and correlate where are these symptoms coming from. That's when I finally realized that pesticide exposure is leading to all these health symptoms in my body, and that's why I need to investigate the pesticide poisoning. But someone who has no healthcare understanding about pesticide poisoning, even if they have 30 symptoms or 20 symptoms or 10 symptoms and they are going to the doctor, and the doctor is completely clueless now that pesticides can also be part of a health issue of a patient, will that patient get the treatment from the doctor if the doctor is completely clueless, not ready to investigate? Even if patient says that every time I breathe pesticides I'm having a health issue, or if the doctor realizes it but the patient's family has been told that don't use pesticides in the home because your patient has now health problems because of pesticides, but the family still wants to keep using pesticides. All of these are also matters that needs to be now understood at a deeper level, because all of these impact the overall patient's health. If the doctor doesn't realize, the patient has already gone, because many of the routes necessary for them to get the right treatment are closed off. If the doctor doesn't realize, if the doctor is egotistical, or if the doctor is unaware, or the doctor is unwilling to do the investigation, there itself the patient is gone. Now how many doctors do I see before I will finally get the treatment depends on how many competent doctors are present in this area. and if they are not competent, and by the time if I am really a severely ill patient, I might even keel over and die before I can go to investigate this with 10 other doctors. There are many patients who have gone through that episode. I'm pretty sure it is not possible that there aren't patients out there in the world who didn't have these similar exposures like me, who didn't die, and all their report would have said was they got heart attack or respiratory arrest. But no investigation has been done because people are not aware that, okay, I got respiratory arrest, but did I get respiratory arrest because I was getting a lung infection or pesticide poisoning or fungal infection? What was the reason for my respiratory arrest? No one is investigating that in India. We don't have those health databases also there in India like in US. So not just in India, there are many countries who do not have the same kind of health database that US has. So our health database is messed up. So real data about a patient's death also doesn't emerge sometimes in India. In my own personal family, all of them who have died, some died for cerebral attacks, some died because of heart attacks, some died because of being hospitalized and other things. But again, whatever the reason was for them to be hospitalized and they died, whatever was clinically reported as their final death certificate thing is not the only thing that resulted in their death. There were a combination of things that resulted in their death. But if people do not wake up to the combination of things that are resulting in someone's death, someone's hospitalization, someone's long-term prolonged disease conditions, you cannot become and emerge into a healthier society, evolve into a healthier society if you live in denial of the factors that impact a person's health. If the factors involved in my health, if I got a really great doctor who gives me all the right tests for all the 4-5 different conditions that might be manifesting in my health right now, I go to a doctor, find a hospital, he or she gives me the right prescription, everything, right treatment plan. There also there are multiple other gaps of healthcare delivery that again needs to be addressed. If I get the best doctor, then after that what needs to be there? The medication that he is prescribing. Like for example, a few years back I had vitamin D deficiency, and in US also I had vitamin D deficiency for a while. So in both the times similar prescriptions were given to me for increasing my vitamin D levels. Same type of prescription, same type of medication was given both in US and in India for ensuring that I increase my vitamin D levels. But at the time when in India, in the past when I had taken vitamin D capsules, I had no health issues with those capsules. But now, because as I said that some high level problems are going on in our country, in our locality, those same vitamin D capsules of the same brand that I had tried previously few years back, this time I didn't do any blood test to see whether I have vitamin D deficiency, but I know what symptoms I manifest when I have vitamin D deficiency. So without doing a blood test, knowing that I'm having a vitamin D deficiency, I went and first I tested by having some protein powder which has vitamin D in it. And when I did indeed drink that protein shake, I found that protein shake was helping me a little bit with my symptoms related to vitamin D deficiency. So then I went and bought the vitamin D capsules from the store, and these vitamin D capsules now have chemical contamination in them. So even though they are being sold as I told you, right, I don't know if I mentioned it in this video, but whenever a medication is created in India or globally, every medication, while the primary ingredient of this medication is vitamin D, it is a capsule which is filled with other ingredients as well. Now, if the manufacturer wants to deliberately introduce health harm, or inadvertently someone introduced a health harm in that capsule, that same capsule which should have vitamin D plus 3-4 inactive ingredients can also have vitamin D plus a chemical that can lead to poisoning of a patient plus 3-4 inactive ingredients as well, which is what I found in these vitamin D capsules. I need someone to investigate all this, but if I know from the taste that this doesn't simply taste of vitamin D, it tastes of vitamin D plus some other health harming elements in it, I can take it to a lab and do a lab analysis, like how some other scientists have done these lab analyses, how newspaper journalists have also done these lab analysis to understand that there are health harming chemicals in our food. So like that with a medicine also, I can go and check and find out if health harming elements are present in that chemical. I can also officially complain to the manufacturer that there is a health harming chemical in your product. But whichever avenue I pursue, that avenue can only work into providing the right effective solution when ethics is involved in the process, when everyone ethically understands that there is a health harming thing you are doing. They need to recall the product from the market, withdraw the product from the market, change the formulation of the product, change the active ingredient from which this product is being created. All these steps they need to do, but that steps of due diligence is not happening in India. Because while what happened with me with the vitamin D capsule recently, I can take the steps to do the tests about it or complain to the company about it. But in the past, for the last 4 years, I have complained about all these products that came up in newspaper articles having some product issues. But those product harm issues have not been resolved. They've not resolved it despite customers complaining about it, despite newspaper articles reporting it, despite research labs doing testing on it. None of these products are recalled from the market. Have you heard any recall of products from the market despite the newspaper articles and government agencies or research agencies having done the due diligence, which shows that there is indeed long-term chronic health harm in these products? So we need some regulatory changes, legal changes, some legal repercussions for those companies who are either deliberately introducing health harm in the market, or inadvertently they have introduced the health harm but are not willing to investigate how to stop the health harm from escalating. Because I can definitely tell you, both with the vitamin D product and the other products I had complained to other companies in the past, because I am from food and drug industry, I have worked in these industries in the past, I have enough theoretical and chemical and microbial knowledge from where these sources are coming from, to know that I can pinpoint actually without even working in that company from where that health harm is escalating in that product. I can tell you that, and I can tell the company that, but if the company is not ready to listen to change that step or take the necessary initiatives to take that step, what will universe eventually set up for that company? That company's overall long-term failure only will happen with that company. When it will happen, I don't know, but its long-term failure is going to be set up if they continuously keep manufacturing health harming products that is not sustainable for a majority of the population, that is going to now in the long run cause great health harm to multiple people. If the universe knows this, if the universe is, because universe is always aware where these things are happening, much more aware than a human might be aware, and that company will fail if they didn't heed the warnings necessary. Like if 100 customer complaints, 100 customer plus regulatory complaints plus other complaints are not preventing any company from changing the direction or trajectory of the long-term health harm they have consistently been doing in a patient's life or in a group of population's life, do you think that company will fail, or do you think that company will continue to exist? How it will fail will depend on God. It can fail from natural disaster. So if your manufacturing facility can suddenly face an earthquake someday, it can fail because enough charges will be filed against you that you go bankrupt eventually. It can fail because of some other reason. I don't know which reason you will fail. But because everywhere in life, this is the karma also of human, not human but earthly living's karma is this, that whatever you are doing, until the moment benefit is present in the things that you're doing in life, be it in personal life, professional life, grand scale professional life, minor level professional life, doesn't matter whether you're a small player or a big player in a whole system, whatever level player you are, your level of impact and influence is going to be disrupted at the level at which it needs to be disrupted in order for that industry to now either shift its direction, change its direction. If you don't shift and change its direction, that industry just simply stops existing as a major industry for because you have not addressed the chronic problems associated with that industry. This is the same way where fossil fuel industries failed in the past. This is the same way where any businesses that have failed in the past have failed in the past. And this is the same way where when business practices are not going wrong, but ethical, social, socioeconomic practices are going wrong in some parts of the country or some parts of the globe, that is when high level natural disaster or high level natural calamity also unfolds in those areas. They are all very interconnected. People don't realize it, but the only way a healthy society exists is when multiple people do healthy, health supportive, life supportive, ethics supportive, socioeconomic supportive, socially supportive, any element of work that we do in life supportive and cohesive and collaborative, and considering each other's needs and health and health related factors are involved, then a society survives, then a culture survives, then a country survives, then a state survives, then a group of people survive and live healthily, and a healthy, meaningful life unfolds. And the moment any of these elements are disrupted, are not working, are not functional, are unethical, are continuously being unethical, are continuously only profit or gain oriented rather than understanding the deeper meaning or higher purpose of that work oriented, that is when systemic failures start showing up. And in India right now, systemic failure of the healthcare system has been showing up for a while, which is now getting pushed more by biological warfare, biochemical warfare related paradigms, as well as nuclear power reactor related bad policies being done continuously in our country. Not just nuclear power reactor, but nuclear power reactor is also part of the problem, but nuclear power reactor related and systemic policy related problems are there in our country, because our country is currently in a status of mindset where complaints are looked as a futile thing, when complaints are the thing that drives true shift and change. If I'm uncomfortable about something, then only I'll complain. And when my discomfort is a high level, then only most people complain. Most people do not complain because they have a habit to complain or they have nothing better to do. Like people in my family has presumed in the last 5 years that I'm complaining because I have nothing better to do. But that is not why I'm complaining. I'm complaining because it needs to be addressed somewhere. I'm also complaining because I do not know tomorrow whether I'll keel over and die from all these things that I'm mentioning in these videos. So if I keel over and die, then also for me a recording of why I keeled over and died, these are the reasons why is necessary for the future generation to understand. If I don't keel over and die, and for 5 years another 5 years of health misery is written for me, then also investigation needs to go and the right I need to find the right doctor, right? So if I create this video and if that right doctor exists somewhere in the world, I need that right doctor to get in touch with me. And not just the right doctor, I also need the right medical facility. I also need the right medicines now, because in this market, as I said, for simple vitamin D deficiency, for simple nutritional supplements, for simple water right now, I have not got good clean water access. I do not have good clean nutritional supplement access. Sometimes I do not have good clean food access. I have been nutritionally deficient at least for the last 5-6 months now, because I'm not getting good clean food, water, air, clothing, home conditions, supportive health conditions. All these are now currently my factors of poor health, such that even though I am living in a house where toxic levels have increased, I just do not have the energy to go anywhere else right now. And I really need supplemental care, right supplemental care, because if some doctor comes and wants to give me even say I'm nutritionally challenged and I need an injection for nutritional purposes immediately. At a time also, if someone comes with a medical bag filled with medicine that will give me the right nutritional supplements, but they are not aware that the water they are using for preparing that medication is polluted, or the medication that you're using has some chemical contamination in them, and while I may be aware but they are not aware, and if they inject it while I am near to dizziness level and near passing out level, at that time, is my most likely health outcome going to be death, or is it going to be death or disability from the chemical contaminations in the water or medicine, or am I going to have a healthy life just because a doctor came with the medicine? Because is the medicine the important criteria for my good health, or is it the right clean health supportive medicine the right criteria? What is the right criteria? Do you understand the difference of why am I making such videos? Similarly, if I'm no doctor comes here, I have enough health to at least walk and take a auto to go to the doctor. Again, the same issue. If I go to a hospital where I went many times to a hospital when the hospital had some competent staff. At that time also they didn't trust their competent staff. Right now the competent staff have likely quit that hospital because they were being disrespected. So now incompetent staff are also present in that hospital, and those incompetent staff do not help with the diagnosis tests. And also, even if a doctor orders 10 diagnosis tests, let's say I'm having a disease where one disease, fungal infection, is causing lowering of blood temperature, cancer is causing increasing blood temperature, and overall my basal body temperature as a result of two conditions is normal blood body temperature is showing up in their reports. Does it mean I'm healthy? But if the doctor looks at my body temperature and doesn't count for the fact that I'm saying I'm facing chills because of fungal infection, I'm facing feverishness also because of the cancer or other thing that is going on with me, if all of these things are multiply combinedly going on with my health, and you are only looking at the clinical criteria that is being measured by a machine, but you're not listening to the patient's symptoms, not understanding the local conditions of the patient's health that is impacting their health. Are you doing right therapy or right due diligence or right diagnosis? Will you ever go to the right diagnosis? If you look at my temperature is showing 97, 98 degree body temperature. But if I tell you that 5 days back my body temperature was 96, 2 weeks back it was 95, 1 year back it was 102, and both of these are going on simultaneously with me. Some days I feel really cold, some days I feel really hot, and the days I feel really cold are the days I have correlated the fact that when I'm feeling really cold, it's because some fungus was there in my food or water, or when I'm feeling really hot, it's because some symptom related to organ damage is escalating or chemical damage is escalating. It is an important subjective evidence from the patient, but it is an important evidence of the fact that the patient is ill. The patient is not mad, and that's why they are getting one day lower temperature or higher temperature. And just because your thermometer is only recording 98 degree doesn't mean that your thermometer is accurately diagnosing the patient. At the time you took the temperature of the patient, they have 98 degree. Have you also? There are so many heart attack patients who go to the doctor for they are getting symptoms of heart attack. All the symptoms are correlating to them developing a heart attack, or they are in the midst of the heart attack. Let's say I got a heart attack. I went to the doctor, but by the time the ECG is recording, it didn't record any anomaly, or even if it recorded an anomaly, the doctor ignored the anomaly because it is not significant. Will every time a patient have a heart attack in front of the doctor's office? No. 90% of the patients who get heart attack, they either had the heart attack before they went to the doctor or after they came back from the doctor's office. So what determines good therapy of a patient? A good therapy of a patient is not determined by the machine that records whether you are actively right now going through a heart attack. The real health of a patient is determined by the follow-up you did or the questions you asked while they were having the heart attack, or the carefulness with which you see the report and don't ignore the report to determine whether they might have had a heart attack. Like I could have had a heart attack at home. By the time I went to the doctor in a few hours or a few days, that heart attack symptoms might still be going on in my body because I had a heart attack. Some systemic shutdown happened in my body, right? So because I had a heart attack, some systemic shutdown happened. It could be that it resulted in a respiratory distress, or it could be that it resulted in a difficulty in walking, and that's why it took me 5 days to come to you, because I was having a difficulty in walking. And in the report, while the if a patient has recently had a heart attack,